the formation of TCM in modern China. According to the research, Korea, China, Japan, and Taiwan all abolished traditional medicine around the same period in the early 20th century. However, within just a few decades, they revived it again in the mid-20th century. Although the timeline above indicates that Japan did not revive traditional medicine, in reality, modern physicians significantly led the revival of traditional medicine in Japan. After the abolition of traditional medicine in Japan, Japanese physicians began to recognize the value of their traditional medical practices and advocated for its application to patients. In 1915, modern physician Wada Keijuro published Ikai no Tetsui. In this book, he compared Kampo medicine to Western medicine and called for its revival. Wada became a symbolic figure in Japan's movement to revive traditional medicine. Thanks to the advocacy of such physicians, most Japanese doctors today use traditional medicine on a regular basis, although Japan does not have a dual healthcare system like Korea, China, and Taiwan. In Korea, Western physicians also played a role in promoting the revival of traditional medicine. Bang Hab-shin, a graduate of Severance Medical School in 1916, advocated for the efficacy of TCM in treating patients. He argued that TCM was superior to Western medicine in certain treatments, particularly for internal diseases requiring pharmacological therapy. He emphasized the need to scientifically study and further revive traditional medicine. The emergence of advocates for TCM from within the Western medical community held significant implications, as their interest in TCM stemmed from reflections on the limitations of Western medicine. In China, the revival of traditional medicine was approached from a unique perspective. The traditional Chinese medicine system started by communist government. This process is detailed in a book, Chinese Medicine in Early Communist China, 1945 to 1963, A Medicine of Revolution, authored by Kim Taylor, a scholar from the Joseph Needham Institute, who spent several years living in China to complete the work. The following content is a summary of this book. The author looks at the transformation of Chinese medicine from a marginal, sidelined medical practice of the early 20th century to an essential and high-profile part of the national healthcare system under the Chinese Communist Party. The book analyzes the political, economic, and social motives which drove this promotion and explores the extraordinary role that Chinese medicine was meant to play in Mao Zedong's revolution. Modern traditional Chinese medicine is a distillation of ancient concepts that have been systematically developed. Today, we use the term TCM extremely loosely, without any temporal or spatial boundaries such as history or geography. However, this term appeared at a specific historical moment, and the epistemological background that formed it is also clearly present. Using the term TCM in a non-historical way is a misunderstanding of the cosmology it represents. TCM is the name of the medicine promoted by the Chinese Communist Party as a state-led medicine. This medicine is performed within state institutions, and its perspective is organized within official textbooks. The institutionalization and standardization of traditional Chinese medicine define the characteristics of Communist China's traditional medicine, and therefore the TCM that we refer to today only functions within these established factors. The above passage is a retranslation into English of the preface from her book, which had been translated into Korean. The author traces the essence or origin of TCM from a historical perspective in her book. The book's important premise is that modern TCM is not a continuous tradition inherited from the past, but rather a deliberate distillation of ancient concepts according to the state's directives in the 20th century. In particular, she believes that this manipulation began in the early years of the Chinese Communist Party's reign. The author argues that if there had been no deliberate manipulation by the Chinese Communist Party, TCM would have existed very differently from today. It is a well-known fact that healthcare systems have evolved in line with changing societal demands throughout history, regardless of country. However, what is unique about China is that it was established based on Mao Zedong's strong anti-Western scientific power. Birth of traditional Chinese medicine. The period between 1953 and 1956 marked a significant time for the institutionalization of traditional Chinese medicine. During this time, the Chinese Communist Party officially institutionalized Chinese medicine by establishing 4 TCM schools following the reintroduction of Mao's revolutionary plans for Chinese medicine. In the West, it is commonly referred to as TCM, but within China, it is simply called Zhongyi, which translates to Chinese medicine without the traditional designation. Initially, what Mao planned was a medical system distinct from Western medicine. It was proudly named Chinese medicine, neither traditional nor modern medicine in the conventional sense. Therefore, the term Chinese medicine used during this period differs from the concept of TCM as we understand it today. However, as Mao's plans eventually failed, Chinese medicine came to signify traditional medicine, and when introduced to the West, the term traditional was added, resulting in what we now call TCM. The Chinese Communist Party's initial goal was to unify traditional medicine with Western medicine rather than preserving it in its original form. This effort began with the Western Doctors Learn from Traditional Medicine program. In 1954, the Ministry of Health launched this initiative to educate Western-trained doctors in traditional Chinese medicine. However, the program failed due to a lack of understanding between Western and traditional practitioners. As a result, the focus shifted toward modernizing TCM itself. In 1959, the government decided to create a national textbook to standardize TCM knowledge. The curriculum was organized into 15 subjects, combining both traditional and modern topics. Traditional subjects included medical classics, the history of Chinese medicine, Neijing, Shanghanlun, Wenbing, various medical theories and case studies. Specialized training focused on skills such as herbology, acupuncture, moxibustion, and formulas. The modern subjects introduced into the TCM curriculum covered areas like diagnosis, internal medicine, surgery and traumatology, gynecology, pediatrics, ophthalmology, and otolaryngology. These subjects were closely aligned with Western medicine, designed to demonstrate that TCM could perform equivalent roles across all fields of Western medicine. This approach was also reflected in the specialization systems within TCM hospitals. The first national textbook was published in 1960, marking the formal introduction of this newly regulated medicine under the name Zhongyi. All textbooks released between 1960 and 1961 were issued by the People's Health Publishing House under the Ministry of Health, highlighting that TCM was a government-led initiative. These textbooks, designed to align with the framework of Western medicine, were criticized for being excessively scientific, standardized and rigid, failing to fully reflect the essence of traditional medicine. Many traditional concepts were omitted during the standardization process, and theories and knowledges from Japan and Korea were mostly excluded. During this period, Western authors began introducing these standardized materials to English-speaking audiences. Prominent first-generation scholars included Manfred Porkert, Ted Kapchuk, Nathan Sivin, and Giovanni Maccioccia. In recent years, even in the West, a growing number of schools have emerged that criticize the version of TCM developed during this time, claiming to teach classical or authentic traditional Chinese medicine instead of TCM. The table below is promotional material from one such school. Analyzing the TCM column on the right reveals that these schools view TCM as overly westernized, scientific, and distorted. For instance, they argue that TCM is grounded in pragmatist philosophies, such as scientific materialism and communism, whereas classical Chinese medicine is rooted in naturalist philosophies, including Taoism and Confucianism. Additionally, TCM treats humans as separate from nature, whereas classical Chinese medicine sees humans as an inseparable part of nature. Additionally, it is quite interesting to note that in the famous book In the Footsteps of the Yellow Emperor, TCM is introduced as merely one among several traditional medical systems of China, Korea, and Japan.